Hi, I am Dr. Obuchi. I see many patients troubled by persistent hiccups. Let me walk you through the latest information about hiccups. This information is sure to be eye-opening. You probably have many questions, such as what exactly is hiccuping, or how can I stop it quickly? I'll answer those questions now. Before we begin, let's share some basic information. Only mammals experience hiccups because they have diaphragms. Hiccups are not spasms of the diaphragms. You might not believe it, but it's true. Are you ready? Let's get started.
Please note this article was written by a non-native English speaker. If you find any grammatical errors or inappropriate expressions, please notify us.
Before answering your questions, here are some medical terms you should know. Esophagus, stomach, esophagogastric junction, or EGJ.
Question 1. What is the cause of hiccups?
Answer 1. The cause is the reflux of stomach acid into the esophagus. It is the cause of nearly all cases of hiccups. However, some people experience heartburn while others do not. Even if you don't feel heartburn, it is still likely the primary cause of your hiccups.
Question 2. Why does acid reflux happen?
Answer 2. It often occurs after eating or drinking. In rare cases, it occurs after taking medications such as antibiotics, steroids, or anti-cancer drugs. This is an endoscopic view of drug-induced esophageal ulcers by antibiotics. Red lesions are ulcers. The patient had been suffering from persistent hiccups. As the ulcer healed, the hiccups resolved. On the other hand, hiccups can sometimes occur completely unrelated to eating. Most such cases actually involve having an esophageal hiatal hernia. This means looseness in the muscles surrounding the esophagogastric junction. Consequently, stomach acid can easily reflux into the esophagus. This is an endoscopic view of a hiatal hernia. Normally, the stomach cannot be seen from the esophagus. This is because the muscles surrounding the esophagogastric junction have loosened.
Question 3. What exactly is hiccuping?
Answer 3. Hiccups are a series of movements that occur when foods flow back up the esophagus, causing the esophagus to expel liquid or foods back into the stomach. Hiccups require not only the diaphragms but also muscles around the larynx to move simultaneously. The movements are quite similar to swallowing. Hiccups actually serve a purpose when food gets stuck in the esophagus. This is an X-ray image of hiccup movement. Hiccups are very similar to swallowing except that the epiglottis does not move. By the way, these hiccups were stopped using Hicaway, developed by Professor Ali Saifi in San Antonio, Texas. The epiglottis is now functioning normally. This video was also provided by Dr. Ali Saifi.
Question 4. What are the underlying causes of persistent hiccups or intractable hiccups?
Generally, intractable hiccups refer to hiccups that last for 2 months or longer. Patients suffering from persistent or intractable hiccups are primarily elderly males, with an average age in their 70s. In fact, persistent or intractable hiccups are a type of lifestyle-related disease. Long-standing habits such as overeating and/or excessive drinking are deeply linked to the onset of persistent or intractable hiccups. Those patients often suffer from concurrent conditions such as diabetes mellitus and gastroesophageal reflux disease or GERD. Lack of exercise also contributes to worsening the condition. In other words, aging and lifestyle habits unfortunately lead to persistent or intractable hiccups. This is an endoscopic view of GERD. Ulcers are found on the esophagogastric junction or EGJ.
Question 5. What is the treatment for persistent or intractable hiccups?
Answer 5. As mentioned in answer 1, hiccups are caused by stomach acid flowing back into the esophagus. Since stomach acid is highly acidic, it causes inflammation in the esophagus. This is what is commonly known as heartburn. In some cases, it can lead to esophageal ulcers. Specifically, inflammation is present not only on the mucosa of the esophagus but also in the submucosa. In some patients, particularly females in their 40s, inflammation is found only in the submucosa. Therefore, in these cases, neither esophageal ulcers nor an esophageal hiatal hernia is detected by gastrointestinal endoscopy. However, the treatment remains the same as follows. We recommend taking the following 2 medications simultaneously. One is acetaminophen, and the other is a strong antacid. Take acetaminophen for several months and the antacid for several years.
Question 6. How can we stop hiccups instantly?
Answer 6. This is a difficult question. At our institution, we can stop even intractable hiccups in about 5 minutes using a gas mixture of 90% oxygen and 10% carbon dioxide. However, this method is not common. Various treatments and remedies exist in the world, so we recommend trying the method you feel is most effective for you.